The Education, Health, and Environmental Affairs Committee with its afternoon hearings on Tuesday. I welcome the committee members and people who will be testifying, who by now should have been given links, and also the public who we welcome to observe government in action. With that, we're going to start with Bill 67. And this is called Emergency Medical Services, Paramedics, Vaccination Administration. And I believe we have Dr. Delbridge first, who'll be followed by Aaron Dorian, followed by Dr. Ciatola, followed by Kevin Kanelli. So with that being said, let's unmute Dr. Delbridge and welcome him on behalf of Senate Bill 67.
Thank you, Mr. Chair, members of the committee. I'm Dr. Ted Delbridge. I'm the Executive Director of the Maryland Institute for Emergency Medical Services Systems. And just by way of quick orientation, MEMS is the state agency with statutory responsibility for overseeing and coordinating the state's EMS system. And we do that by credentialing, licensing, and certifying EMS clinicians, by designating the state's emergency medical services operations programs, by designating the state's trauma and other specialty care centers, and by running the statewide emergency medical services communication system. The current law, which we seek to change, was enacted in 2000, over a generation ago, and it authorized paramedics to administer influenza and hepatitis vaccines and administer TB skin tests as part of occupational health programs. So basically confine these activities to other public safety personnel. It didn't include paramedics who worked for commercial ambulance services, and unfortunately didn't anticipate the need for additional vaccines. And it does not account for paramedics as a potential important feature of public health service force multipliers. Senate Bill 67, we believe, provides a framework for paramedics to administer additional vaccines, those included on the CDC's recommended schedule for adults. It includes paramedics working within commercial ambulance services. It appropriately requires oversight by the EMS medical director or other qualified physician. It requires approval by MEMS, and it requires a partnership between the EMS agency and the local health department or hospital or health system. And I would emphasize that this is exactly what we have been doing during the COVID-19 pandemic situation. EMS personnel are acting as public health service multipliers. They're engaged in vaccination efforts, but all that is made possible by the governor's declaration of a state of emergency, and their abilities to participate will go away when that declaration goes away. But the need to vaccinate will extend, we believe, although nobody can predict the future, we believe will extend long after the governor's declaration has expired. So I'd stress that we're seeking to use EMS as a force multiplier, assisting local health departments in fulfilling their missions. This isn't a case where we're looking for EMS personnel or EMS agencies to be striking out on their own to be mass vaccinators. We want them to be collaborative with other folks and invested in that effort and absolutely not acting independently. We're recommending 3 amendments to the current proposed bill for your consideration. One is we'd ask that this be considered as emergency legislation so that it would go into effect immediately upon its approval. We have also suggested some language clarifying the role of EMS medical director oversight in one place. And we'd like to add language that includes vaccines provided under FDA emergency use authorization. And it's important to point out that is the current designation for the COVID-19 vaccine. And with that, I'll be happy to answer any questions.
Unless people have pressing questions, I'd like to get through all 4 witnesses and then take questions of any of the witnesses at once, unless there's a pressing question.
Mr. Chairman?
Yes.
Yeah, I do have a question. I apologize because I have a hearing that's 30
Please.
seconds in finance. But my question is, I'm going to have to run to this other bill hearing for mine. In light of the recent MDH order last month that allows basically anyone who's properly trained or supervised to administer the COVID vaccine how does this bill differ from the current order already allowing this to happen, right? Because I think MDH had put out an order last month allowing anyone who's properly trained or supervised to administer the vaccine. Why is this bill needed then?
Well, two reasons. One is the MDH order will go away when the current COVID-19 declaration of emergency goes away, and the need to vaccinate, the need to be participants in public health efforts as a force multiplier won't expire when the current crisis goes away. You could imagine at times in the future the need for influenza vaccination campaigns and things like that. Up till now, EMS has been excluded from those efforts, but in other places in the United States, those efforts are way more common. The other thing is because of the structure of the EMS system, the MDH order requires essentially those personnel to do it outside the system in which they currently operate. So in order to
and I apologize, I have to hop off for this other hearing, but but this would also apply to more than just the COVID vaccine, right? And then I'll take it offline for
this bill would apply to more than the COVID vaccine. That's correct. And the MDH order is exclusive to the COVID vaccine.
Okay, then let's go to Aaron Dorian, if we could. And don't go away, Dr. Delbridge. We might come back to you for more questions.
Okay, thank you, Mr. Chairman and members of the committee. My name is Erin Dorian. I'm the Director of Government Affairs and Policy at the Maryland Hospital Association. We represent every hospital and health system in Maryland, so we have 60 members of our association. So we support this bill with the amendments offered by MIMS because we believe this is really necessary in order to fully deploy future vaccine efforts. Currently, hospitals are working to vaccinate every hospital staff member and frontline worker within their walls, but they are beginning to look to the future when their services may be necessary to scale up really mass vaccination efforts. So right now, what we're dealing with is a shortage in vaccine supply. We hope that shortly we will no longer be dealing with that vaccine supply shortage, but we will need to make sure that we have every single available vaccinator to help really make sure that those vaccines get into arms. So this bill will allow Maryland's hospitals and Maryland's health departments and other public health authorities to really use those skilled and available paramedics and EMS providers to help get those vaccine clinics stand up. And we think that that you should pass this bill with the amendments that MIMS is suggesting. So with that, I will pause. I don't want to say much more. I know that Dr. Delbridge, has all of your questions answered, and I'm here to answer any questions you may have for the Hospital Association.
Thank you, Ms. Dorian. Let's go to Dr. Ciatola.
Good afternoon, Mr. Chairman and members of the committee. I am Dr. Joseph Ciatola. I am representing as both the EMS Jurisdictional Medical Director for Queen Anne County, as well as Queen Anne County's Health Officer, and also as a representative of MACHO in recommending that this bill be rapidly passed with its amendments for the importance of what we're facing here in this pandemic. And having been the only dual health officer and EMS jurisdictional medical director has allowed Queen Anne County to have the opportunity to integrate our public health community nurses with our EMS clinicians, specifically our paramedics, in multiple programs over the last 7 to 8 years, specifically with mobile integrated health, in which we have used the skill sets of both the paramedics as well as the nursing community health nurses. The skill sets and the scopes of practice are certainly different, but they're complementary when you're looking at population health, especially with the disparities in health and health inequalities. And with this pandemic, we have set up an EOC that has been combined and unified between DES and the Department of Health. And when you look at the amount of vaccination that we have been able to do with the limited supplies that we have received, we're putting 99.9% of our vaccines in arms right now. And that is because of the work of not only the community nurses and our staff, but also the workforce expansion by having 14 to 16 paramedic clinicians in the field running these vaccination sites. I would strongly recommend approval and moving this bill forward. Thank you.
Thank you, Doctor. And let's go to Kevin Kanelli, please.
Thank you, Mr. Chairman, members of the committee. Kevin Kanelli here on behalf of the Maryland Association of Counties in strong support of Senate Bill 67. Counties support this bill, as you've heard, because it would help our local health departments carry out public health initiatives, and specifically, it would help to improve vaccination rates, which is one of the most successful and effective services for preventing disease and death. We know that our local health departments play a vital role here, and we will continue to advocate that they receive the proper funding and support for staff, services, and technology. So you have my written testimony, but this is a great bill. It provides our local health departments with needed assistance to carry out these public health initiatives, which are vital, especially right now. So we'd ask for a favorable report.
Mr. Kanelli, do you also agree with the amendments offered by Dr. Delbridge?
We do.
Okay. Okay, a question for any of the panelists. Questions for any of the panelists? Seeing no hands, I'm sorry, Sen Ellis.
Yeah. Okay. Thank you, Mr. Chairman. I have a question for, I think, Dr. Delbridge. Thank you for all you do, sir. And I just want to know if we allow, say, paramedics to really get in these other areas, vaccinations during this current pandemic, we have paramedics being detailed to do mass vaccinations. I'm wondering the impact on service for communities, especially since the last few years have been changes in the standards and certification, recertification for paramedics makes it more difficult for so many more to, excuse me, I forgot to sound my phone. It's made so much more difficult for paramedics to really come into the field to get certified. And I'm just wondering, that's one question I have, and if you could answer that, and I have a follow-up question for you.
So thank you for the question. And there are two parts. One is the skill set required to provide a vaccine is consistent with the scope of practice for paramedics already. So it isn't an additional learning module that they need to pursue in order to be effective vaccinators. And two, the EMS operational program of which they are a part would have to be the judges, the determiners of whether or not it is something that they can incorporate into their operations going on. As Dr. Ciatola explained, he has a particularly novel way of doing that in terms of dedicating part of the EMS service to this concept of mobile integrated health, which is allowing Queen Anne's County to be effective at doing that. But for any jurisdictions to be involved in collaborating with the local health department or health system or hospital, they'd have to make the decision about their bandwidth to be able to do that or not.
Okay, yeah, thank you for that. And the second question, can I ask that second question, Mr. Chairman?
Absolutely.
Okay, thank you, sir. And so, we are in this pandemic now of the COVID-19 and affecting communities throughout America really in a dramatic way. There's also another pandemic in America of police violence directed against African Americans and state-sponsored terror, I call it, and others call it the same thing also. And there was an incident earlier last year, where an individual was detained by the police. They called the paramedics, and paramedics gave an injection of sedative to this individual, which was, really I was going to say overkill. Well, actually, the individual ended up being dying from the overdose of sedatives to calm him down. And so I just want to know, in Maryland, can paramedics be called out when police shows up? And if they can police order them to provide a sedative to individual because they're overactive or anything like that?
The short answer to that question is no. And we, this summer, in light of national news, reminded the EMS community, paramedics, by way of executive notification, me and the state EMS medical director, reminding them that they can't take orders from police. That is not their job to restrain people on police order. They carry sedating medications as part of their clinical armamentarium, if you will. Probably poor choice of words. Their pharmacy that's available to them in order to effect safe transportation of patients to medical facilities. But they are not expected nor allowed to take orders from police, and we don't expect police to give them those directions. We monitor all the cases where sedating medications are given for anything other than pain control or to facilitate airway management to ensure that we're providing the very best and safest care possible.
Okay, so to recap what you said, in Maryland, absolutely no, they're not allowed to provide those services to police officers.
Well, they don't take orders from police. That's correct. They take orders from base station physicians.
Okay, great. Thank you, sir.
You're welcome.
Thank you, Senator Ellis. I was a little thrown. It was a gold raised hand instead of a blue one. I'm used to blue, the raised hands on the Zoom being blue, and it threw me when I saw it was yellow. I didn't pick it up at first.
Yes, sir.
Being no other questions and no opposition to this bill, I think everyone agrees support with amendments. That concludes the hearing on Senate Bill 67. Thank you, witnesses. Obviously, you're free to stay around and watch the other bills, or maybe you're testifying on other bills. But we're going to move ahead to Senate Bill 125, Board of Chiropractic Examiners Sunset Extension. I believe we'll start. We have two witnesses, Heather Scheck from MDH and Paul Abosh from Board of Chiropractic Examiners. Welcome.
Thank you, Chair Pinsky, committee members. Can everyone hear me okay?
Perfect.
Great. My name's Heather Scheck. I am the Deputy Director of Governmental Affairs at the Department of Health, and I'm here to testify in support of Senate Bill 125. This is a Department of Health departmental, and it just extends the Board of Chiropractic Examiners statutory and regulatory authority for 10 years. So in essence, it extends it until July 1st, 2032. There have been no reported issues with the board. There are no outstanding deficiencies. The most recent sunset evaluation report from DLS is actually from 2009. They only do them on a request basis now. And within that report, again, no issues. And I believe a copy of that report was submitted with the department's written testimony, but if the committee wishes, I'd be happy to provide a copy if necessary. So I will just keep it very short and sweet. No issues, no deficiencies, and importantly, the bill has no fiscal impact. So the department would just request that the committee return a favorable report. Thank you.
Thank you, Ms. Scheck. Let's go to Paul Abosh, and then we'll take questions.
Thank you, Mr. Chairman, and thank you, members of the committee. And again, I assume everybody can hear me as just fine. Like Ms. Scheck, my name is, well, not like Ms. Scheck. My name is Dr. Paul Abosh. I'm a licensed chiropractor in the state of Maryland and a voting board member on the Maryland Board of Chiropractic Examiners. And I'm here also to request approval and support of this bill. As Ms. Scheck correctly pointed out, the Board of Examiners has no outstanding deficiencies to correct. Passing of this bill will ensure the successful continuation of our board's mandated responsibilities, which are to protect the citizens of Maryland through credentialing, examination, licensing, and disciplinary procedures for chiropractors. Additionally, during our current state of pandemic with COVID-19, this bill enables the chiropractic board to assist the state in managing the pandemic by allowing for expeditious licensing of qualified chiropractors, which in turn will allow our licensees to manage musculoskeletal conditions which would otherwise drive Maryland citizens to the emergency room, which is not a place they want to go to unless they really have to. Similar to, I will reiterate Ms. Scheck's request that I respectfully request that this body pass this bill and there should be no outstanding controversy surrounding it. And I thank thank the members for their time.
Thank you, Mr. Abosh. Questions for Ms. Scheck or Mr. Abosh? Obviously, it's a sunset extension. I don't see any hands up. I'll wait another couple seconds. Seeing none, that concludes. There are no opponents signed up or either with written or oral testimony. So that concludes the hearing of Senate Bill 125. Thank you, both of you. Okay, let's go to Senate Bill 141. State Board of Public Accountancy Education Requirements. We have Gregory Morgan. I'm sorry. We have Gregory Morgan. I'm getting feedback here. From Department of Labor.
Somebody must.
In mind. Well, I'm getting feedback. We're going to work on it.
So,
Gregory Morgan, followed by Sinead Jordan, please.
so ask him, is he?
Mr. Morgan, do you have your YouTube streaming on?
I'm unmuted. Can you hear me?
Right. But do you have your YouTube also on?
I do not.
Okay. Please begin.
Ready to start?
Yes.
Good afternoon, Chairman Pinsky and Madam Vice Chair Kagan and members of this committee. My name is Greg Morgan. I'm Commissioner of the Division of Occupational and Professional Licensing within the Maryland Department of Labor. Joining me today is Sinead Jordan, who is Executive Director of the Maryland State Board of Public Accountancy. I joined the Department of Labor on September 9th, 2021 upon the departure of Commissioner Vicki Wilkins, who you may have been expecting today. We appear before you today to ask for your support in the passage of Senate Bill 141, which is presented to update and correct obsolete references to two educational institution accrediting bodies. Can everybody hear me okay?
Yes, you're fine.
Okay.
I'm getting feedback for me, but you're doing fine.
Yeah, I'm not sure why that is. The first organization, formerly known as American Assembly of Collegiate Schools of Business, has changed its name and should be recorded in the statute as the Association to Advance Collegiate Schools of Business. The second organization, founded as the Association of Collegiate Business Schools and Programs, has changed its name and should be recorded in the statute to reflect the change to the Accreditation Council for Business Schools and Programs. It is important that the existing statute be corrected to reflect the accurate names of these two accrediting institutions to avoid confusion among candidates for licensure with the Maryland State Board of Public Accountancy. We have been advised we cannot change these names in the annual corrective bill since it may not be clear and well understood. For those reasons, we request a favorable vote. We appreciate your consideration of this legislation and at this time welcome any questions from the committee.
So, Ms. Jordan, do you have anything to add or you're just back up?
I'm sorry?
Is Ms. Jordan just back up for questions, or is she going to testify?
No, she's just back up for questions.
Okay, questions for Mr. Morgan? Seeing no hands, that concludes the hearing on Senate Bill 141. There are no sign-ups for opposition, either written or oral. Thank you very much, both of you.
Thank you. Thanks for allowing us to testify today.
Let's move to Senate Bill 247. State Board of Podiatric Medical Examiners Sunset Extension. Once again, Ms. Scheck, followed by, well, I guess Ms. Robinson on behalf of Ms. Schwartz, which we generally don't allow, but today we will, since we're starting to get this airplane built right. Ms. Scheck, you want to start?
Yes, thank you, Senator. Good afternoon again, Chairman and Committee. Heather Scheck with Deputy Director of Governmental Affairs at the Department of Health. I'm going to just play my previous testimony on repeat. This is another sunset bill and Department of Health departmental that extends the Board of Podiatric Medical Examiners statutory and regulatory authority for 10 years, again, until July 1, 2032. There are no reported issues with the board, no outstanding deficiencies. Again, the most recent sunset evaluation report was in 2009 with an update in 2010. And I believe that the committee has a copy of this report as well. The bill has no fiscal impact. And so in closing, I would just say that the Department of Health supports this bill and requests that the committee return a favorable report. Thank you.
Okay, let's go to Ms. Robinson.
Thank you, Mr. Chairman and members of the committee. Can you hear me okay?
Yeah, Ms. Robinson, please share with Ms. Schwartz going forward. If people sign up and don't show, they can't defer to someone else. So we're
had a sudden death in the family, and we did.
I understand.
Actually aware of it.
No,
Okay.
okay, all I'm saying is we have a lot of bills and a lot of hearings, and it's not about her not being here. We understand that you have a death in the family, but because there are so many bills and people at the last moment want to defer, and we have sign-up lists, going forward, we're going to be very limiting in allowing fill-ins. But we're going to have you go today, and we appreciate it, and it's nobody's fault.
Sure. Thank you. My name is Dr. Candice Robbins, and I am actually the Executive Director of the Board of Examiners for Audiologists, Hearing Aid Dispensers, and Speech Language Pathologists, here to testify on Ms. Schwartz's behalf on Bill SB 247. As Heather said, the bill extends the termination provisions relating to the statutory and regulatory authority of the State Board of Podiatric Medical Examiners for 10 years until July 1st, 2032. We support Bill SB 247. The board has no outstanding deficiencies to correct, and the passing of this bill will ensure the continuation of the board's mandated responsibilities of protecting the citizens of Maryland through its credentialing, examination, licensing, and disciplinary process for podiatrists. Additionally, during the recent boards and commissions audit by the Department of Legislative Services, the board was not identified as having any deficiencies. I thank you for considering this testimony, and we look forward to requesting a favorable report on SB 247.
Thank you, Ms. Robinson. Any questions for Ms. Scheck or Ms. Robinson on Senate Bill 247, sunset extension once again? Seeing no hands, that concludes the hearing on 247. Thank you all.
Thank you.
We're going to skip over 262 for the time being and 305. We'll come back to those. So let's move on to 342. That is Maryland Military Department sale of superfluous armories. We have Wendy Scott Napier from DGS and Catherine Kelly from the Department of the Military. Please begin.
Good afternoon, Chair Pinsky, Vice Chair Kagan, and members of the committee. I am Wendy Scott Napier of the Department of General Services Office of Real Estate. I'm the Assistant Secretary for the office, and I'm here today to provide our support for Senate Bill 342. This bill will allow armory properties that are surplus to the military department to be considered for other state agency use before they are offered for sale to a local government or to the public. The current law provides for the county or municipal corporation where the armory is located to have a right of first refusal to purchase the armory property. Should another state agency express interest in the armory, the clearinghouse process would be utilized. A cost savings to the state would be realized through this legislation by not having to pay for appraisals and title work that is needed for a new acquisition. My final comment, we noticed a drafting error in what was submitted, and we have shared this with the committee staff. The bill as it's written incorrectly refers to the Department of Planning. Incorrectly refers to the Department of Budget and Management and should in fact refer to the Department of Planning. Those are my comments, and we ask for your support of Senate Bill 342. Thank you.
I apologize, I was muted. Thank you, Ms. Scott Napier, and let's go to Catherine Kelly from the military. Ms. Kelly, are you with us?
I am. Can you hear me?
Yes, yes, we can.
Good afternoon, Chairman Penske and Vice Chair Kagan, as well as members of the committee. For the record, I'm Catherine Kelly. I am the Legislative Director of the Maryland Military Department. I'm pleased to share our support today for Senate Bill 342, the Department of General Services effort to clarify the process by which a state agency could receive an armory our department declares superfluous. We look forward to this effort, which can streamline the process of divestitures, as they can be rather costly to us when they have to go through the full process. We respectfully ask the committee give Senate Bill 342 a favorable report, and I'm happy to answer any questions you may have.
We do have a number. Let's start with Senator Washington.
Thank you, Chairman. Can everyone hear me?
Yes.
So I guess I'd like some clarification. What's the process by which you determine that a armory is superfluous, or I guess you're adding it to the surplus? And how many armories do we have in Maryland? So two, how many do we have, and what's the process for determining? Thank you.
Currently, we have in excess of 40 armories. 6 of them sit on a divestiture list right now. The determination is made when we have to combine units, or if the force protection standards can't be met because of an armory that is 40 or 50 years old, not sitting on the right amount of property, or not sitting in an area where it's most needed.
So just a couple of follow-ups. So you said there are 6 currently that you're seeking to divest
in various stages of divestiture.
Could you tell us a little bit about what that means? What does that mean exactly, divestiture?
If we were to find that an armory was no longer needed for the National Guard purposes, we would plan for divesting of it. We have to rehouse units that are in them. It can take 3 to 10 years to plan for appropriate housing for our units, and changing the needs that our armories fulfill for our units.
So is that closure? You're closing it down, so you're moving. Again, this is not, I'm not familiar with this. So,
Right.
So I'm really trying to understand.
In years
Yeah.
past, I mean, the average age of our facilities is coming up a little bit. Excuse me, is coming up a little bit. Like our headquarters at 5th Regiment Armory, Woodrow Wilson's Democratic Convention was held there. So some of our buildings didn't face the needs of our units today. We didn't have females in our units. So oftentimes we find that our older buildings don't suit the needs of the National Guard.
Great, thank you. Thank you, Chairman.
So my understanding is they can close them now, but they're adding another step. They offer it to the other state agencies before it goes to the local municipalities.
Well, I got that, and that's part of what I was getting to was that. So you're wanting, there's some original deal that happened where you offered the first right of refusal to local jurisdictions. So of course I'm interested because there's a very large one in Baltimore City, right?
Roger, ma'am.
So,
when we identify that an armory no longer fits the needs of the National Guard because they are state properties, we just make that identification. I would like to defer to Wendy about the process that happens within DGS and the Department of Planning, because we don't direct that process. We just do the identification that the building is no longer something that is superfluous, that's something that the National Guard is in need of, and then the appropriate state agency takes over with the divestiture and how in which that happens.
Okay.
So Senator Washington, to get back to your question, we have been working on disposing and selling military armories for years, and we've always worked with the statute as it's written, but we encountered a situation where a state agency had expressed interest in a property, and in consultation with our Attorney General's office, we realized that the clearinghouse process actually came into existence years after the armory legislation. The surplus armory legislation was written, and it didn't take into account the specific requirements for military armory properties. So we were in a situation where we were actually not able to offer it to a state agency. So we have a property that's had a lot of state funds poured into it. There may have been, in fact, federal funds initially to acquire and build the armory, but over the years, it's been a lot of state funds put into the property. So this legislation is really trying to correct that. And it's not to say that a state agency will always want an armory property, but it's to correct the process and allow a state agency during the clearinghouse review steps to raise their hand and say, we may have a use for that property. A good amount of the time, I still think they're probably going to go to the local governments. Does that answer your question?
That's very helpful. Thank you.
I'm sorry, I forgot to unmute myself. Let's go to Senator Riley, followed by Senator Hester, followed by Senator Ellis.
Thank you, Mr. Chairman. For either of you, is the bill specifically for structures? The title seemed to indicate equipment.
Well, it is for the armory real estate, so to speak. So we're talking about the building and the land that comprise the armory. If usually military will move out any equipment that they can from the armory to their new facility.
Thank you very much for that clarification. Thank you, Mr. Chairman.
Okay, Senator Fry Hester, followed by Senator Ellis.
Thank you, Mr. Chairman. Miss Wendy Scott Napier, your office was incredibly helpful to our office 2 years ago when we were working on a report that had to do with
previously owned state historic complexes, ranging from hospitals to armories and the like. I was just curious that the report came out with tons of recommendations, but I believe one of the recommendations had to do with some kind of ongoing governance and economic development, support whenever the transition of a building happened. And so I wondered, in this particular case, is there a plan for the continued kind of revitalization of this armory when it transitions, so that it doesn't become, kind of a white elephant sitting there?
And Senator Hester, did you have a particular armory in mind, or because we were looking at this legislation really for the future and for armories that may be surplus in the future?
Well, I guess I'm interested in both. I thought that Senator Washington had mentioned a particular armory that might have been the subject that brought this legislation forward. I actually think this is an incredibly important area, I think that probably your legislation addresses like a tip of the iceberg, but it requires further consideration on how we deal with state property.
Yes, I agree. It is a strategic process to try to work with state agencies, work through the surplus and disposal process to make sure an armory doesn't fall into further disrepair and can get into the hands of a new entity that will help preserve the property and improve the property. I would say right now, there is no comprehensive plan, just the ongoing work between agencies to try to help that process move forward as quickly as possible. And this legislation will definitely do that if an armory is staying in state hands. For armories that are going out to a local government, we try to, where we can, run dual tracks. And by that, I mean, while we're going through our various state requirements, going through the clearinghouse process, ordering appraisals if we need to, doing investigations of the property, maybe environmental investigations. If we in fact know that a property is definitely going to the local government or even to the market, we will be talking to the local government to try to speed up the process at all, just to have all the conversations and keep it moving and not go step by step and make the time linger. So I can say that that is what we're doing now, just using the knowledge that we have to try to run dual tracks. And if an armory is going to move into the hands of a local government, try to do that as efficiently as possible. I can give you one example. We recently
brief Ms. Scott Napier, please.
I'm sorry. Or I could talk to you, Senator Hester, offline if you'd like to.
Let's follow up offline. It looks like Senator Washington might want to join us.
Okay.
Thank you.
Senator Ellis, to you.
Thank you, Mr. Chairman. And I'm not sure which presenter can answer this question. So the process currently is an excess armory that the local jurisdiction have first right of refusal on that property. Is that correct?
That is correct. And the way it's worded, it's the local government that has the right of first refusal without the state having the initial ability to say they were interested in the property.
Okay, and so you want to change that to have the state agency, other state agencies have the first right of refusal on that armory.
That is correct.
Okay, and so the thing is, these are pretty much old buildings and pretty much an eyesore. So I have one in my district in Charles County. That's, I guess, somewhere in the process. But these buildings are usually, like you mentioned, some of them go back to Woodrow Wilson and beyond. They're old. A lot of them might have asbestos, and they're eyesore in the community. The land has moved really, I know in my district, to be much more valuable. And why would we want another state agency to take over an old decrepit building? And, I'm not sure why that would be desired. I'm not following the rationale for that.
So I think it's going to be a case-by-case basis where an agency may have use for the property. I think I shared earlier that I think by and large, it is probably going to continue that we'll be transferring and selling these to a local government or to the public sector. But we want to reserve the ability for the state if the property could be reused by a state agency, because then we would save the cost of having to acquire a property and pay for appraisals. So I agree with you. It's not going to be very often, but we're hoping to have the legislation change so that when we need to do that, we can do that.
Yeah, and that's the question I asked. I'm not honest following you, why that would be necessary. If you have this very old building and all these issues, why would we want to move any other state agency in there when the National Guard say it's not good enough for us? I mean, with all those issues with mold and asbestos, I mean, why would we want to move any of our state workers into an old building like that? And why would we want to preserve that pretty much eyesore in the community where it's at? I'm not sure what the need would be to do that.
Senator, I think that's beyond Ms. Scott Napier's position. It's just to offer to anybody else if they want it. It'd be up to DGS and other departments who might be interested in it, maybe for a different purpose. I don't know. They only are the ones who want to clear it out. And instead of just going right to municipalities, going to the state, which you can agree with or disagree with, but I'm not sure she can speak for why another agency might want it.
Okay, thank you.
But I do have one question. Obviously, what Senator Ellis said raises questions. When we're accessing, are we accessing the building and the property?
That is correct.
So someone could tear down the armory and rebuild on that property?
Only if the Maryland Historic Trust has agreed that there should be no historic easement on the property. And many of these armories are required to have an easement.
Meaning that they must remain?
In many cases, the building must remain, the outside facade must remain. They may, depending upon what the Historic Trust says, they may be able to make changes to the interior. But if the building remains, the outside has to remain the same.
Right, but there could be major renovations.
You're right. It could happen if Historic Trust agrees with that.
And this policy also sits with municipalities that might be interested in the building.
Yes.
Okay. Also, I'm willing to go back to you if you want to pursue this line or whatever. Okay. Further questions? Further questions on the Senate bill? Seeing none, that concludes the hearing. On that bill, we're going to go back to Senator Eckert. Senate Bill 262, Department of Information Technology, study of a common information technology platform for health occupations boards. We have Senator Eckert. Then we have Rachel Faulkner. I don't know if she is with us today or not. She's not with us today. So Senator Eckert, you're up and you're the only one.
Thank you very much, Mr. Chair.
There's no oral or written opposition.
Great. Thank you very much, Mr. Chair, Madam Vice Chair and committee members. I'm delighted to be here today to present to you Senate Bill 262, which came before your committee actually last year. It is to create a study for a common information technology platform for our health Occupations Board. As you know, each one of our boards is responsible for generating licenses and renewals, and that has gotten to be quite an issue, particularly during our COVID experience this past year, and being able to get people credentialed and into the workforce in a timely manner. And because it has created a little bit of a bottleneck, I think now is the time that we need to move forward involving DO-IT and the health boards to be able to go ahead and review all the technology platforms, all the aspects as they work together to make recommendations on the feasibility and the cost of developing a common IT platform, which each of them can use. Seems to me that if we have a common platform and everybody having a link to be able to access it, it would render it more efficient and more cost effective in the long run. The Board of Physicians, I think, has worked on this before, and I think currently the Board of Nursing is working with the department in conjunction with DO-IT to pursue this, and there may even be a template that they're working from. So I am recommending this bill, urge your passage of it. It passed in the House last year, and it got stuck, as we called sine die and crossover in 2020. So I would recommend your favorable consideration and passage of this initiative. Thank you.
Thank you, Senator Eckert. And obviously last year was a complicated year, and a lot of bills got stuck, particularly in our committee late in session. Senator Riley.
Thank you, Mr. Chair. The Senator Eckert answered my question, and when she did, I didn't have a way to lower my hand, so never mind. But if there's a technical way to do it, it'd be helpful to the committee to understand that. Thank you, Mr. Chairman.
Okay, further questions for Senator from the Mid Shore? I don't see any. Senator Eckert. So thank you. And we have another bill of yours. That concludes the hearing on 262. So we will move to Senate Bill 305, legal advertisement or legal notice publication newspaper. Senator Riley, once again, that topic hits us twice in one day. We have Senator Eckert, followed by Donna Lane, followed by Rebekah Snyder. It's my understanding Mr. Butler and Mr. Connors are not on with us. So you're on again, Senator.
Thank you very much, Mr. Chair and Madam Vice Chair and members of the committee. I'm here, Senator Addie Eckert, on Senate Bill 305. This was brought to us. It's a local delegation bill. And I have with me Donna Lane, who is really going to tell you why this has come before you. But if you would look at my backdrop, I just want you to know that that's the harbor in Cambridge. And Donna is actually sitting probably in an office on the other side of behind me. So we thought we'd bring you a little bit of taste of Cambridge today. But just wanted to let you know that in Dorchester County, we only have 2 news publications in which to promulgate the notices that legally have to be generated and presented to the public. One of those has decreased their distribution to 1 day a week, and the other paper is down, I think, to 4 days a week. So it's created a real issue. And as Donna Lane will present to you, they are offering this initiative as an alternative to make sure that there would be proper notification and engagement of the community for those notices that require that kind of advertisement in our local papers. So I would urge your favorable consideration. And I know there's been some opposition from some of our media on this because they're concerned about the cost. We are not taking away the publication in the print media. We just want an alternative to be able to make sure that everybody has an opportunity to access the information that may be necessary to them in their financial situation. So without further ado, I'd just like to say, here's Donna.
Good afternoon, Chairman Penske and committee members. As Senator Eckert said, there's only two publications, the Dorchester Banner and the Star Democrat, that qualify as a newspaper of general circulation in the county. The only reason we can still use the Dorchester Banner, which only publishes the paper on Wednesday, is because of the Wednesday date. If they were to change the date to Thursday or Friday, we could not use them. The majority of our ads have to be on Wednesdays. They have to be 2 consecutive weeks, 7 days apart for any of the public hearings, any legislation, that would be road closures, bonds, that type of thing. The Star Democrat doesn't have an online version either on Monday or Tuesday. We have to use the Star Democrat in some cases because we need to advertise 14 days prior to the hearing, and that requires a Sunday. If for some reason, as I said, the Dorchester Banner decides to change its date, we can no longer use them. If the Star Democrat goes all totally online, and the Dorchester Banner is no longer there, we have no way to advertise. The concern is that they all moved to an online format, and we not know that. Star Democrat did not notify us either time with the Monday or Tuesday date. We did get notification from the Dorchester Banner, and I personally asked them to change the date of publication to Wednesday so we could continue to use them. Unfortunately, if something were to happen and both of them were to go online, we would have to wait for legislative relief. That could mean a couple of months, or it could mean a year or more if something happens with COVID. Our concern now is not going online. Our concern is being able to go online if we do not have the news publications, because if we don't and we have to wait, we have to cease all business. So no business can be conducted until we receive legislative relief. Thank you.
Thank you, Ms. Lane. I want to apologize. We do have one other speaker who's unfavorable. So let's stop and take questions for Senator Eckert or Ms. Lane before we move to unfavorable. Questions for the sponsor or the proponent? Seeing none, we'll go to the opponent, Ms. Snyder. Welcome.
Good afternoon, Senator Penske, Vice Chair Kagan, and members of the committee. I am Rebekah Snyder. I'm the Executive Director of the Maryland, Delaware, DC Press Association. We represent a wide variety of news media, including the Star Democrat and the Dorchester Banner. And we really do appreciate the transparency and commitment to notice from Ms. Lane and Senator Eckert. But this legislation, which is not just a Dorchester County bill, this is a bill that changes the very definition of newspaper of general circulation throughout every statute where that phrase is used in Maryland code. It's extraordinarily broad for a problem that literally doesn't exist. I understand the concern and the worry about publications moving online. There is no jurisdiction in the state of Maryland that does not have a print publication. Dorchester County is super lucky to have two. And the Dorchester Banner, which I think the county government uses primarily in this instance, actually even flexed and worked with county government to change the date of their publication to make sure that county government could publish properly. So, and in talking to both those publications, there's absolutely no worry, concern, or intention on the part of those publishers to reduce print publication. But what this bill does is there's not a way to understand how it would be archived and verified. I think this is just such a big issue that it's overkill on a problem that doesn't yet exist. And so I would ask for an unfavorable report just because it's overkill on a problem that doesn't exist yet. And I don't anticipate existing for many, many years. and I'm happy to take questions or questions from the group. Thank you.
Question from Ms. Snyder, Senator Ellis.
Yeah, thank you, Mr. Chairman. Ms. Snyder, so I really don't understand why you would oppose this bill, in that it doesn't exclude the print versions. It just include also online versions. Could you clarify that for me?
Sure. So there's a couple things in that, and thank you for that question. So right now, when a publication is printed, some of the tenets of proper public notice are that it is accessible, that it is archivable, that it's verifiable, and that it's independent. So on the face of this bill, you know, it checks the independence piece, which is super important for us, but it doesn't, the online version of publications can be a little, one never knows what the public, you can't always make sure that it has been verified in the way that one would expect. So I think there's concerns about that. It doesn't put the print publication as primary. It says that it can be either or. So I think it introduces some confusion in the marketplace. And the way that it's written, you know, it has to be in the online edition. So it's basically like the PDF copy of the publication at its most basic level, I think is what it's kind of talking about. Whereas there are, like for instance, the Star Democrat does publish stories on Mondays and Tuesdays when they're not in print. Does that mean that that's not an edition? So I think it's just kind of fraught with some confusion there. And it doesn't, I think that it's just too broad a bill. And we don't know, I can't sit here and say that I know every point in the statute where newspaper general circulation is defined. Like I know how it would affect this particular issue. I have no idea where else it might be that could cause a conundrum. So again, it's just, it seems like it's a really big change that hasn't been assessed for a problem that doesn't exist in Dorchester County.
Okay, thank you.
Mm-hmm.
Senator Washington, I apologize.
Oh, no worries. It does, the platform does keep changing. Thank you, Ms. Snyder, for that. And for two things, it, you know, was sort of presented as sort of a local concern. I am interested in your assertion that it's changing the definition and its impact across, you know, other portions of the code. So if you could follow up and let us know about that, and I'm sure that's not Senator Eckert's intention. So I very much would like to see how we can address their particular issue, but also not have the kind of broad, which I would share your concern, the broad impacts of redefining and making more ambiguous, you know, communication.
Mm-hmm. And certainly, I definitely want to make sure that Dorchester County is getting what they need, and all jurisdictions are getting what they need in public notice. And so I'm hopeful that we can figure out a way to move forward. I mean, obviously, we would prefer just to not, in this type of session where you guys are dealing with so many issues right now, this seems like a stretch. Why deal with this now? But we're happy to work in community with Ms. Lane and the senator on this.
Yeah, we could walk and chew gum. We have to deal with this matters to the people of Dorchester. So the big things and the small things is what we do, because it's big to somebody. So I appreciate your willingness to help us work this out.
Thank you. Senator Simon Ayer.
Yes, thank you for your testimony, Rebekah. This is not a new issue. I've been down here many years, and different variations of this have come about. From a state standpoint, you know, the purpose of this statute is to notify the public. I mean, that's our goal in this statute. And over the years, you have been resistance to change, and I think some of it is a financial concern, but things are actually changing technology-wise. I mean, look at us today. We're on Zoom. More people get information online, even with the news, and the readership is going down. So I think this will be the way of the future. So my question to you is, are you willing to work with the sponsor and try to come up with a compromise, or are you object to any change?
You know, I don't, that's a fair question. I do sit it here almost every year and say, you know, transparency is not served by truncating public notice, and it really isn't. So I would say also that public notices are printed in both print and online. So you can see them on the Southern Maryland News website. You can see them on the Dorchester Banner website. And so when we think about print and online, we really do think of total audience. And it's a huge commitment to make sure that they are published in that way. What's different about this bill from many other bills is the independence is preserved. And so there's a lot to be said for this type of solution. What really, but it's a very broad bill. It's kind of spongy in some ways, and it doesn't address, for us, it doesn't address that archivability and verifiability issue. That doesn't mean that we can't, you know, work through it. I'm not sure that this is something that we'll be able to work through for this. It's a big conversation, but I feel like if I weren't willing to work with you, I would tell you that. And so it is, we've had conversations with the senator. I've had conversations with Ms. Lane to talk about this.
So that was kind of a spongy answer. Are you willing to work with her, was the bottom line on this legislation this year?
I'm willing to work with her. I am not guaranteeing that we will come to unity, I guess and I don't feel like that's a spongy answer. That's the truth. We're willing to talk to anyone, but public notice is a big issue in terms of transparency, in terms of how it's delivered, and we want to make sure that it's done in a way that we feel comfortable with.
Okay, all right, thank you.
Thank you, Senator. I see no other questions for this witness. Mr. Butler has joined. I think it's Mr. Butler, Alex Butler has joined. He was a proponent. I'm going to give him some deference and very briefly give him our opportunity to speak about why he favors the bill.
Thank you, Mr. Chairman, and good afternoon to you, Mr. Chair, and the rest of the committee. Alex Butler, representing the Maryland Association of Counties, here in full support of the bill. This bill, as we read it, simply updates state law to allow current notice publications to be satisfied through online publications. This does not remove newspapers from the public notice process, but allows for those online publications in newspapers. I think as newspapers, especially local papers, transition in some cases online, publish print options, we want to make certain that our members are in compliance with state law, and this bill will help them do that. I think that we would be thrilled to work with the Press Association and the sponsor and the committee to make sure that we make it work for everyone and just make sure that our members are in compliance. So thank you very much, Mr. Chair. I really appreciate the deference. And with that, I'll end my testimony.
A question for Mr. Butler. Thank you, Mr. Butler. Seeing none, that concludes the hearing on 305. Madam Vice Chair.
Thank you, Mr. Chairman. The next bill is Senate Bill 345. And first up is the Secretary of the Department of Information Technology, Secretary Leahy. Nice to have you here.
Thank you so much. Good afternoon, Mr. Chairman, Madam Vice Chair. Wonderful to see you, members of the committee. I'm Michael Leahy, the Secretary of the Department of Information Technology, and I really appreciate this opportunity to provide our testimony to your committee. The Department of Information Technology supports Senate Bill 345. The purpose of the bill is to increase the dollar value threshold from $100,000 to $200,000 that triggers the requirement that the Board of Public Works approve a resource sharing agreement and to minimize the review of those agreements. The bill would require agencies to notify the secretary of any proposals regarding the sale, lease, exchange, or other disposition of communication sites, facilities, or frequencies. And under the current law, the state units generally must defer to do its oversight and approval process when considering a resource sharing agreement proposal to allow private industry to use a state resource, such as a state right-of-way, for an information technology purpose. And what we've seen is that the low threshold lengthens the review process, which delays delivery of fiber optic infrastructure and services in a more comprehensive cellular communication coverage, typically with disproportionate impact on citizens in rural Maryland and on small businesses that are operating in the telecommunications workspace. Basically, private industry fiber and cellular providers rely on their speed to market, and consumers rely upon competitive marketplaces to provide their essential cellular and internet access. And so approval of this bill, of Senate Bill 345, will hasten our ability to bolster expansion of this infrastructure and service, while also reducing the common grievance we've heard from industry that speed to market in Maryland is an obstacle. For these reasons, the Maryland Department of Information Technology respectfully requests a favorable report on Senate Bill 345. And I and Norm Farley, my director of this area, are available for your questions. Thank you so much.
Thank you, Mr. Secretary. Deputy Secretary Farley, will you be testifying? I see, oh, sorry, Mr. Shine is not with us, but Mr. Farley, is there anything you'd like to add, or just?
No testimony, but I'm standing by for your questions.
Perfect. Colleagues, do you have questions? Senator Carrozza.
Thank you, Madam Vice Chair, and thank you for the testimony. Just one brief question. You mentioned the delays that are having some impact on small businesses, and given everything that small businesses are facing right now with COVID-19, was there any one particular sector or area, and you also mentioned rural areas, that we were having some problems with these delays?
Well, certainly it is small companies that are attempting to provide services that have limited markets, that the process of getting these approvals for them to utilize infrastructure takes 90 days longer than most of them can survive to make these things happen, because they have to rely on larger providers for the interconnections, things of that sort. And so it has been our experience over the last 2 years that a number of telecommunications providers that are sort of mom and pop operations in small communities and rural areas have said that the approval time precludes them from actually being able to get this work.
And if I can add, most of these smaller value resource sharing agreements are for crossing under a road, like putting a conduit under 100 feet of right of way to get from one side to the other. And right now we're adding 90 days to that process. So the RSAs where they want to run 50 miles or 100 miles alongside a highway, a much higher dollar value, and they'll still go through all the other review processes. But the way to have an extra 90 days added on just to cross a road really slows things down for everybody.
Okay, thank you. Senator Ellis.
Thank you, Madam Vice Chair. Gentlemen, so the question I have is, what volume of transactions are there between that space, 100 to 200,000, 100,000 to what volume of your transactions, what percentage per year?
Certainly, Norm. Could you answer that, please?
I've got some statistics between 2014 and last year. There were 17 of those. However, there were another 31 that were in that range. And what the vendors did was, so that they wouldn't trigger it, they shortened the period of performance, the contractual period, so they could get under the limit. And so which means, 5 years later, or whatever, they have to go through the process again. So in total, there were about 48 agreements that we were aware of that would be affected. And we don't know is how many had never happened because they just didn't want to go through the process or couldn't survive.
Okay, thank you. And so this is because of, I guess, are you saying the inefficiencies of the Board of Public Works in processing these?
No, well, it's not just the Board of Public Works, but there was a 60-day review period for the LPC. So there were 60 days there, then 30 days for the Board of Public Works. And it's just the period of time it takes to go through the whole process and get on the schedule. That just adds to the whole length of time for getting these things approved.
And Senator Ellis,
Mr. Farley, just for those who might be watching and for senators who don't know all the acronyms, could you please translate LPC for us?
Legislative, now I've just forgotten. Legislative
Policy Committee.
Policy Committee, exactly. I'm
Okay.
sorry. I've
Just
used it so often I've forgotten.
That's okay. Thank you. Secretary Leahy, you were going to add something.
I was going to give the definition of the acronym.
There you go. Perfect. Great minds.
Yeah.
Senator Ellis, did you have a follow-up?
Yeah, thank you, Madam Vice Chair. And so I'm just wondering, if we take away levels of supervision and you have a large volume of these smaller pieces of transactions, I'm wondering, who is there to make sure certain things aren't done right? Should we not look at maybe working with the Board of Public Works to streamline the process? Because I'm just curious about that as far as just take away that level of supervision. Who would look over and make sure the agency is doing right by our citizens?
Norm, do you want to start? Then I'll finish up.
Well, first is DO-IT reviews all of the proposals from the other agencies. So we're the first check to make sure that everything is correct. And we have an office, we have staff who that is their full-time job, is to review those things and make sure they're following all the wickets, all the policy, and everything is right. So I'll leave the rest to the secretary.
Sure, and I think the other aspect of this, Senator, you make a very good point, is that historically, the Board of Public Works has followed our recommendation based on the processes and policies we have in place. And as Mr. Farley said, the sorts of projects we're talking about here are typically economically and in terms of the impact environmentally and on properties is minimal. So to the extent we do have more complex projects for telecommunications facilities, those certainly should remain under the purview of the Board of Public Works. But in many cases, because they tend to always accept our process recommendations, we believe without a change in how these
Mr. Secretary, you're muted.
I'm sorry, so we can continue to protect the citizens' interests in these matters.
Okay, thank you.
Okay, thank you, Senator Ellis. I see no other questions. Patrick Mulford, I'm noticing you down here. I don't see your face. Are you with us? And is there anything you'd like to add?
No, there's nothing I'd like to add. Thank you.
Okay, thank you for being with us. If there are no other questions, colleagues, that concludes the hearing on Senate Bill 345. The next bill before us is Senate Bill 348. Secretary Leahy.
Thank you again. Good afternoon again, Mr. Chairman, Madam Vice Chair, members of the committee. I'm Michael Leahy, Secretary of the Department of Information Technology, and I want to thank you again for this opportunity to provide testimony. To put it simply, security is at the forefront of the Hogan administration's efforts on a day-to-day basis to be proactive and centralize our approach to cybersecurity. We believe this is essential to protecting Maryland's data and keeping government infrastructure protected from ever-increasing threats. I'm going to let our CISO, our Security Information Officer, speak to the specific approach that we are utilizing. But I would like to add that, his office, the Office of Security Management, and the Maryland State Cybersecurity Coordinating Council are the glue that are going to hold together our programs going forward. And because of the advantages this bill creates, the Department of Information Technology respectfully requests a favorable report. And Mr. Stewart and I are happy to answer any questions.
Thank you, Secretary Leahy. Chip Stewart.
Good afternoon, Madam Vice Chair, Mr. Chairman, and members of the committee. It's great to see you all. My name is Chip Stewart, and I'm the Maryland State Chief Information Security Officer. As you know, cyber threats are increasing on a daily basis throughout the world. In an effort to strengthen the state's cyber posture while also solidifying its ability to manage and minimize the consequences of cyber attacks, in July of 2019, Governor Hogan signed an executive order which created the Maryland Cyber Defense Initiative. The value of this action was apparent over the past year, with DO-IT and the Office of Security Management facilitating the resolution of several cyber disruptions across the state. In an effort to create a unified statewide cybersecurity program, the Maryland Cyber Defense Initiative created my position, the State Chief Information Security Officer, the Office of Security Management, and the Maryland Cybersecurity Coordinating Council. Senate Bill 348 codifies the governor's executive order into law. My role as the Chief Information Security Officer is to protect the confidentiality, integrity, and availability of Maryland information systems and state-owned data. In this effort, I will lead the Office of Security Management in directing, coordinating, and implementing the overall security policy for all state agencies in the executive branch. The Maryland Cybersecurity Coordinating Council provides strategic advice regarding the implementation of cybersecurity program, as well as working alongside internal and external stakeholders to provide recommendations to build and sustain the capabilities necessary for the state to identify, protect, detect, respond, and recover from cybersecurity-related events and risk. The MCCC, which is the Maryland Cybersecurity Coordinating Council, is comprised of state officials representing numerous agencies and departments throughout the state. Having high-ranking officials from these agencies is a huge asset in working together to coordinate the cybersecurity strategy throughout the whole executive branch. The bill also requires legislative and judicial branches of government to certify they're meeting minimum security standards to be on Network Maryland. The concept that the chain is only as strong as the weakest link applies for those branches of government as well. In addition, the bill mandates that all executive branch agencies send a report to the governor comprised of a data and system inventory. We've attached a single amendment that would add the Secretary of the Maryland Department of Disabilities or their designee to the MCCC. For these reasons, I would ask that you give SB 348 a favorable report with the amendment attached, and I would be glad to answer any questions that you have. So thank you.
Thank you, Mr. Stewart. And again, Deputy Secretary Lance Shine is not with us, I believe. And I just want to make sure, Patrick Mulford, is there anything you'd like to add?
There is not. Thank you very much.
Okay, thank you. Secretary Leahy, Mr. Stewart, thank you for all you do to keep Maryland's government and entities safe. And I know that as chair of the Next Generation 911 Commission, I know that Senator Riley and I are grateful for your work on cybersecurity when it comes to public safety and your collaboration. So thank you for that. I am guessing that Senator Hester might have a question, since she's such an expert on these issues. Am I right, or are there any other questions?
I do have a question. Thank you, Madam Chair. And thank you, Mr. Secretary and team, for being here to present this excellent bill. I just had a couple of questions. The first one is, as you know, we worked together last year to put forward an Office of Cybersecurity Coordination within MEMA to kind of bridge the gap between state level expertise and kind of boots on the ground at our localities. And I don't see anything in this bill that would prevent that from going through this year. It seems like the two would work really, really well together. Would you agree?
Thank you, Senator Hester. I am going to have to look at that bill again a bit more closely, but certainly we are favorably disposed to enhancing our communication and coordination with agencies. The entire point of what we're trying to do with security is to standardize it and to make our responses to any breach or any security problem swift and conclusive. So theoretically, this certainly does not present any issue. And the real question is how we do communicate with the boots on the ground and make sure that our efforts actually fulfill the intent.
Great. Well, I'd be happy to talk through that bill with you. It is pre-filed.
Super.
On the website.
Absolutely. Would love to.
My second question is about the exemptions in your bill. Could you, and maybe this could be happening, offline, but there's several exemptions, including public education institutions, the Port Administration, University of Maryland, St. Mary's College, Morgan State University, and the Stadium Authority. And just, knowing what just happened to our Baltimore County school system, I remain concerned that we exempt our school system and also our local health departments, which I believe are also on our ISP, from anything, that provides that structure and consistency that this bill speaks to. So could you speak to why it makes sense to exempt these organizations from this bill?
Well, I think the simple answer, as Mr. Stewart said earlier, is that we are still establishing policy and processes that they must meet our minimal standards. And because many of these organizations have complex interactions within their own organization and with other aspects of the state government and with the citizenry, it appears at this time that I'd like to get our house in order in the executive branch and look at how they propose to address these issues from the policy aspect. I'm a firm proponent that although we've said standardization and consolidation are a good thing, I'd like to have other voices telling us things that we may have missed. This is a iterative process, and the more of us that are engaged in it in a collaborative way, the better off we'll be. But to your point, if indeed the proposals they make do not meet our policy processes, we would fully expect them to address the concerns we raise so that they can continue to utilize the state network facilities. Chip, would you like to add anything?
No, sir. I believe you covered it completely.
Does that address the concern, Senator Hester?
She will ask you if it doesn't.
Thank you, sir.
We're not bashful. Thank you, Senator Hester. Senator Ellis.
Thank you, Mr. Chairman. So I had the exact same question as my colleague, Senator Hester. Why these exemptions? And so I just want to say, Mr. Secretary, you spoke about standardization and being an Air Force culture. When you say standardization means you have no exemptions, right? So if we don't have these exemptions, if we have these exemptions, that means that these various agencies have to do this themselves, which means a duplication of effort and additional cost to the state. And so will the resistance be too much if you try to include these agencies, University System of Maryland, who are doing great research in a lot of technical areas, right? So you would think they are under severe threat of attack. They're doing important national research. So what do you foresee as the resistance in including these agencies in the cybersecurity protection of DO-IT?
Well, I suspect you remember that when we originally posited this idea, we did not include exemptions. And a number of agencies were vocal in their concerns about DO-IT's capacity to address the specific issues that they faced because of their size and because of the complexity of their network interaction with the Maryland network. So in discussions with them, as I said to Senator Hester, we have come to the conclusion that so long as they meet the standards that we are establishing and the policy requirements, we're open to looking at other ways to approach security, simply because, although we agree in standardization, we have to be nimble to resolve issues that we may not have thought about. And so, yes, there will likely be additional cost, but there will also potentially be cost savings because the organization we have in DO-IT is not of significant size. And to address all of the issues of large organizations like the education system, we would have to dramatically increase the size of the DO-IT organization. Whereas I believe our leadership at Mr. Stewart's office, working with the people on the ground in the specific entities, can agree on how to approach this. And if there are problems, as I said, we will be the first to bring them to the partner's attention. And if this process does not work properly, we'll be back to talk to you folks as shortly as that proves out, if it's the case.
Mr. Chairman, could I follow up with a quick question? Okay, yeah, thank you, sir. So,
Sure, yes.
Okay. I saw your head bobbing up and down, so thank you. So you're saying in the bylaw, these agencies are exempt from oversight, but then you went on to say that you will have them reporting to you on their processes, and so it's a voluntary thing, right? And so they can say, hey, this is we don't want to do it, then they have no obligation to do it, to actually follow up with DO-IT. Sure. So the thing is, I remember, was it last year, 2 years ago, one agency came to me and said, hey, that original bill you mentioned would cost an additional $70 million for them to upgrade. And so is there any way you could absorb that cost in your agency and do the oversight?
Not that I'm aware of. That's more than my general funds budget at this point. However, having said that, sir, the other aspect of this is that even though we do not have direct oversight over them, we do have control of Network Maryland. And if they wish to continue to use it, they will have to be more transparent with us than to just say, we're not going to tell you.
Thank you.
Okay, seeing no further questions, that concludes the hearing. Thank you, and we'll go to the final bill of the day, which is 351, Protection of Information Revisions Data Privacy Act. We have Secretary Leahy, Chip Stewart, Mr. Mulford, and I'm not sure Lance Shine is with us. There is unfavorable written but not oral. So you may want to check your file at some point or electronically for that testimony. Mr. Secretary.
Thank you again, Mr. Chairman, Madam Vice Chair, and members of the committee. I'm Michael Leahy, Secretary of the Department of Information Technology, and I appreciate the opportunity to speak on Senate Bill 351 today before the committee. As many of you have heard me say before, data privacy governs how data is collected, shared, and used. It has become a significant issue, not only for those of us in government, but for people across the nation as well as in the state of Maryland. And data and cybersecurity have a very interesting relationship in regard to data privacy. In order to protect data, one must know what it is, what's comprised of the data, where it is, and how it's being used. And our principal responsibility to our citizens is to maintain their trust and good faith that the government is operating transparently, efficiently, and in concert with these concerns about their data. So Maryland residents, like people all over the country and world, are becoming increasingly interested in understanding how and why information about them is being collected, stored, utilized, and shared. And this bill not only demonstrates the state's commitment to adopting best practices to protect our citizens' data in our care, but implementing numerous best practices and policies providing citizens with previously non-enumerated protections codified in revised section 10-1304 D2. And then finally, for those who might argue to this body that the provisions of this bill concerning personally identifiable information are overly broad because revised section 10-1301 D6 states that information from multiple sources that when used in combination with each other or other identifying information can be used to establish individual identity, which will cause unconscionable workloads and confusion for units of the government. Section 10-1302 concerns where this subtitle does not apply and remains in force. So the Maryland Data Privacy Act modernizes the way the government agencies secure and manage personally identifiable information. The bill requires agencies to mirror federal practices for ensuring that personally identifiable information is protected from unauthorized access, use, modification, or disclosure, and citizens must be advised whether the disclosure of certain PII is voluntary or required, how that information is shared with third parties, and be provided with an opt-out provision where possible. This is near and dear to my heart personally, and for the reasons I've stated above, I ask that you favorably report on Senate Bill 351. Thank you so much.
Thank you, Mr. Secretary. Mr. Stewart, you have anything to add?
Yes, sir. Good afternoon. Again, my name is Chip Stewart. I'm the Maryland State Chief Information Security Officer. I'm here in support of Senate Bill 351. My primary objective, again, as the State Chief Information Security Officer, is to protect the confidentiality, integrity, and availability of Maryland information systems and state-owned data. The Maryland Data Privacy Act helps accomplish this goal. The bill helps agencies to comply with current Department of Information Technology standards in dealing with data privacy, which are closely aligned with national standards and best practices. Under this legislation, certain agencies would be required to collect, process, and share PII in a manner consistent with the requirements set forth by the Maryland Department of Information Technology, including identifying and documenting the governmental purpose for the collection of the data, notifying individuals when PII is being collected and describing the purpose, implementing reasonable data handling procedures to ensure the confidentiality, integrity, and availability of the data is maintained, incorporating privacy requirements into the agreements with third parties that handle PII while under contract with the state, ensuring the accuracy, relevance, and timeliness and completeness of collected PII, only collecting PII that's relevant to the legally authorized purposes of the collection, allowing individuals access to their PII, and allowing them to correct or amend the collected PII. And then also informing the individual or public of practices and activities regarding the use of their PII, including any rights the individual or public has to decline, correct, or review that information. So this bill is essentially the same bill that the Department of Information Technology submitted last year, with one minor change that substitutes a specific requirement for security standards, such as FIPS, the Federal Information Processing Standards, with security protections that are consistent with the Department of IT policies and regulations. The DO-IT policies and regulations generally align with the federal standards, but we didn't want to create a circumstance where the legislation forces the use of a standard. As those standards evolve, we could be stuck with an older revision. So with that said, I'm happy to answer any questions that you might have.
There's one that I'm going to take the other proponent. There's one question, but I'd like to finish the proponent, Mr. Mulford.
I have nothing to add.
Okay, and Shine is not with us, so we will open it up to questions. Vice Chairwoman Kagan.
Thank you, Mr. Chairman. Thank you, Mr. Secretary and Mr. Stewart, for this bill. I just had two quick things. One is last year, Senate Bill 588, which was passed, applied to the University of Maryland. Wondering if you did any collaboration with the university, what you learned, what you thought about changing. And the second question is, I'm wondering why this bill had a sunset, and if you could speak to that.
Chip, would you like to talk about what discussions, if any, you've had with the university system?
So this past year, we haven't had any collaborative discussions with the university regarding this specific topic.
And I think part of that, Madam Vice Chair, is simply because of the other issues we've all faced with responding to the pandemic and the shortage of funding. Just there hasn't been time to move that along properly. It is certainly my expectation that we will begin those discussions as soon as things get a bit more normative. With regard to the sunset provision, I personally don't like that, but because of the vast change we're seeing with regard to privacy legislation, I suspect that the folks in the legislative shop that are thinking about those issues wanted to make sure that if we needed a clean slate, we would have time to discuss that while this went into force, and we had some time to look at its impact and determine if that was the right course.
Great. Thank you.
Thank you, Mr. Chairman.
That concludes the hearing. Now, we did have two people in opposition with written testimony, Mako and the City of Baltimore. As if you've read the fiscal note and other things, they have concerns about the mandate and the authority of the state on this. You should take your time to read that. We heard this bill last year. The Senate version, the House bill passed the House and came across, and then we dealt with the pandemic. So this issue and parts of it were before us a number of times. So with that, this concludes the hearing on 351. Now, before we adjourn, let me just say to anyone following streaming on YouTube, the members of the Education, Health, and Environmental Committee are called to testify in other committees. They have meetings they have to take. They meet with their chief of staff. So at times they will be out of their little box on Zoom, or if you were here in person, out of their chair and behind their desk. So that's part of life here in Annapolis. We have a lot of responsibilities. Clearly, everyone is committed to understanding and learning as much about the issue and the bill as possible. But unfortunately, there are times when people are called away. That being said, that completes the hearings for today. Thank you all. Thank you, committee members. Thank you, public. And we're adjourned.